Hello, my name is Daisy Moran, and my research question is how do mental health services impact the long term housing stabilities in homeless youth and young adults? I chose this research question because throughout my time volunteering in human services settings, I ran across many youth and teenagers that were homeless, and it made me really think about what more we can do as a community to help set them up for a better future. So, according to youth.gov, approximately 3.5 million youth experience homelessness each and every single year here in the United States. And about 69% of that youth that is experiencing homelessness is having some sort of mental health crisis or suffering from mental health issues. The current system today focuses heavily on immediate housing. However, this is only a temporary solution that often goes into repeated cycles of homelessness without addressing the mental health aspect of it. So, there are federal programs that are assisting individuals with mental health issues at the moment who are currently experiencing homelessness. According to the World Health Organization, they support a lot of community-based health services. They provide localized, accessible care through outpatient clinics, peer support groups, and mobile crisis teams. According to the World Health Organization, community based programs have proven to be more effective in helping individuals with their mental health rather than institutionalization. So, community based programs actually work with these individuals to help them with their day to day life, things like finding jobs, maintaining relationships, going to their doctor's appointments, setting them up with social workers, helping them prepare for interviews, things that are a lot more useful and prepare them to learn how to navigate life on their own, especially since they're so young. Research from the US Department of Health and Human Services actually shows that many serious mental illnesses, such as schizophrenia and bipolar disorder, actually emerge during adolescent years or early adulthood, which is why it's so important for us to focus on finding solutions or ways to navigate this for these individuals at a young age. Currently, there are a few federally funded programs that assist individuals with mental health services who are experiencing homelessness, such as the CSC or the Coordinated Specialty Care and the RAISE program, which is recovery after an initial schizophrenia episode. The CSC provides team based treatment that includes psychologists, social workers, and vocational specialists to assist individuals experiencing homelessness. Similarly, the RAISE program has significantly improved outcomes, including increased participation in work and school and better overall quality of life. There's also some great community-based programs here in Buffalo that are assisting youth with mental health issues that are experiencing homelessness, such as NAMI, or the National Alliance of Mental Illness here in Buffalo. So the NAMI program actually is helping individuals with things such as psychological rehabilitation, employment assistance, crisis intervention, and peer support services. So there are also other resources that help with individuals going through crisis, such as the 1-800 Runaway, which is the National Runaway Safe Line. And what's great about this resource is that it's so easily accessible. You don't need an appointment. You don't need to walk in anywhere. It used to be just a phone number, is now accessible either through text, phone call, online. So in today's day and age, anybody can really access it. And what they provide is immediate support and crisis intervention, such as referrals and support services through phone, As mentioned earlier, there's a big emphasis on the housing first approach to this, which means that they just find shelter for these individuals going through a homelessness situation. And although that's very important and definitely a priority, I think it's still important to acknowledge the barriers that these programs also have. So, with programs such as Housing First, they don't really require any individuals to engage in any treatment or meet specific conditions. And while it can provide critical short term relief, it doesn't exactly address the underlying uh, cause for homelessness amongst these individuals. Some of the barriers that this program faces currently is also underfunding. According to the Center on Budget and Policy Priorities, there are currently 44 agencies with more than 737,000 applicants waiting for shelter or waiting for an opportunity from this program because even the ones that qualify, they just don't have enough funding to meet the demand on people and families that require this service. Having gone through this research and also firsthand experience in my volunteer work, I felt the need to look more into this subject because I am a health and human services major, specifically with a community mental health concentration. And I thought that this was important for me to know more about because it's important to me that our community is doing something to help people that are struggling, especially when these individuals in question are so young, young adults, or even teenagers. Overall, I'm convinced that helping youth and young adults going through mental health situations that are experiencing homelessness is critical for the betterment of our community.